I'm Dr. Lokesh Babu, a psychiatrist working in Sneha Manavikasa Kendra, Tumkur. So today we will be talking about addiction. So addiction is the biggest menace that world is struggling with, and we all know there is an increase in alcohol dependence post-COVID in Indian scenario. So what would be the reason for this addiction, and what are the damages that it causes to us? And what has started as a recreational usage, how it can turn up to become an addiction, and what are the people prone for it, and why it is harmful to an individual. So, to define an addiction, first of all, or what is we call it now in newer terminology, it is substance dependence syndrome. Because addiction per se is a stigmatized word, so now we call it substance use or substance misuse or substance dependence syndrome. So, what do we mean by substance dependence syndrome? A person who cannot stay without the substance. Okay, so, that is what happens with the person. So, there are like stages which a person goes through. Number one, the person will be experiencing in the absence of the substance, he is not able to function. Second thing is sometimes he will be wanting the substance as soon as he wakes up in the morning, what we call as an eye opener. Number three is there will be a behavioral changes in the absence of the substance if it is not available at the time whichever they used to take it. And there will be a radical change in his socio-occupational functioning. There will be a radical change in his interpersonal relationships. There will be a change in his work ethics. There will be a change in his economic issues, and also there will be a change with his sometimes they entangle with litigations and criminality and violence and things like that. So this is the intensity that substance abuse can cause to an individual. So when do we decide, like for oneself, like I have an dependence issue, now I should require a doctor to see whether it may be a cigarette tobacco dependence or it may be a alcohol dependence or any other uh, available drugs or drugs which are illegal or which are used. The moment any individual thinks that he cannot function in normal life, he cannot perform normal sleep, he cannot have a day-to-day regular life in the absence of the substance. That itself is the primary criteria to visit a doctor. When I started, like if you have to know, any person who starts dependence syndrome, he never imagines or assumes that he would be end up becoming a dependent. Everybody thinks that they are starting with as a recreational and they always feel that they have an absolute control over themselves as long as they supervise the substance which is causing the dependence. So usually starts the teenage levels in the college time because of the peer pressures or to prove something about themselves to the crowd, or sometimes in the later age. So what started as once in a 6 months or only in occasion, a drinking or a smoking habit, slowly turns into a monthly habit, then it becomes a weekly usage, then it becomes from week to daily usage. From daily usage, what happens is the quantity starts increasing. Like first, somebody used to drink 30 ml, then or a beer, then it becomes like 2 beer, 3 beer, 4 beer, then shifted to other substances which contain more alcohol, up to 40 to 42%, like whiskey or rum or any other kind of a substance. So there is a gradual increase in the usage of the drug, and the days involved in usage of the drugs are now they are more wide compared to the earlier, and there is a persistent pattern of a similar timings. The individual who goes and uses the drug, and of course now he feels that he has to manipulate the family and friends and everybody to isolate himself to get the drug or find the group of people who would indulge in the similar kind of behavior. So what started as recreational, now to sleep he needs to have the same substance. Sometimes in alcohol, what happens? Without alcohol, the patient will start getting tremors of the hands, tremulousness, and he will be able to concentrate well. There will be a panic feeling or anxiety feeling within his chest. There will be restlessness, excessive sweating, and profuse sweating and irritation will happen. And by the time, like if he is used to drink every day at 6:37, so as the time approaches, he starts becoming extremely restless, sometimes violent, aggressive, and manipulative, and some by hook or crook he will find a way, or he will have some rationalized reason to go back and drink alcohol or do the substance which he is being used to. So that is how your brain and physiological system gets involved. So anybody who starts with substance abuse, never ever think that it is something which is in your control, because there is a physiology which is involved in it. There is a part of the brain system which gets habituated to it. Even though you are inside and your willingness to stop it, sometimes you may never be able to do that. So that is the time that you will require hospitalization. Sometime there will be a physiological harm which will happen to your liver, your kidneys, and your blood vessels and your brain as a result of taking substance abuse. So respiratory problems in nicotine are also very common in substance abuse disorders. So one has to be very aware whenever we start any substance. That is the time that we got to recognize what is the pattern that I have actually related to any other behavioral issues. So if I am prone for a substance abuse, for example, if I am emotionally unstable, if I have an hyperactive issues like ADHD and other things, if I have a mood issues, frequent mood issues, these are the people who are very susceptible. If there is a family history of any substance abuse, my father, uncle, anybody uses substance, there is to be an alcoholic or a smoker, the tendency is that we also end up becoming alcoholic or substance. The tolerance level becomes extremely high for us. Sometimes there are a few people, they don't drink on a regular basis, but they will say that I drink only once in a month or once in 2 months. What we call as a binge drinking. They would binge for 10 days, 15, a continuous 10 to 15 days. Then they stop it for the whole period of 6 months. And they think that they have started drinking and they have stopped drinking and they have an absolute control over their behavior. In reality, it is not so. The change in your emotions, change in your mood, promotes you to go and drink at that particular time. So it is a mood dependent behavior. Then when you are actually stopping the alcohol, it's not that you actually choose to stop the alcohol. The brain itself gets aversion towards it. So you will go and find medical help to stop it. So whenever you get a next impulse, you have to recognize that it is going to be the same cycle, which is more harmful. There are a lot of deaths happen because of that. There is a cardiac issues, and there will be hematemesis because of the acute problems related to the esophageal varices, and there are a lot of complications which are associated. So these are few insight into the addiction and addiction related problems. So it is always better to know about your own personality before you start any addiction, any substance use, and be aware that any substance you try, you may end up getting killed by it one fine day. So having a discussion with your psychologist or psychiatrist, and having a better interpersonal relationships in the family members, and having a healthy habits like waking up early, jogging or visiting a gym or being spiritual also has been found to be advantageous in preventing or delaying the substance abuse disorders. So thank you.